So today I'm going to be talking about how medicine tariffs threaten global health and finance. So what we're going to be talking about today is the research question notes based off my presentation, key terms and concepts in English context, 2 case studies, and why this all matters to finance as a whole. So my main research question was, how do pharmaceutical tariffs disrupt global drug supply chains, and what are the financial consequences for developing countries? So before we dive into the 2 case studies, here are some key concepts and terms to know. So first, tariffs, as we know, are taxes on imported goods. Governments usually use these to protect their own local industries, but they can also lead to a much increase in prices. Then APIs, or active pharmaceutical ingredients, are the chemical parts of a drug that actually make the drug work. So for the US, over 70% of their APIs come from China and India. Then generic drugs are just cheaper versions of brand name drugs like ibuprofen, and they rely heavily on the APIs to stay affordable for the healthcare system. And then FDI, or foreign direct investment, means money in business operations that companies from one country bring to another, and this could be like opening like a drug factory in another country. And then finally, the most important concept probably the pharmaceutical supply chain. And this is a complicated system that includes a network of organizations and technologies that are involved in producing and delivering medication from manufacturers to patients. And of course, this whole process is very global. So a drug might be researched somewhere in Europe, but the APIs are coming from India or China, and then they can be packaged in somewhere in South America before it finally reaches the patient in the designated country. So if tariffs are added at any point in this whole process, it's just going to make the system much more expensive and more risky. So for some global context, recently, as we know, the US has proposed more tariffs on medicines and medical ingredients from China, India, Canada, Mexico, and the EU. This all is a big deal because, as we know, drug supply chain is international. So if countries start taxing each other, medicines, we can see a lot of shortages and a lot of price spikes, especially in those cheaper generic drugs, which help keep the healthcare system affordable. And this problem isn't just international. The US is also seeing some implications now. For example, the American Hospital Association has already warned that tariffs might cause dangerous supply gaps later on. So for the first case study, we focusing on Venezuela. So Venezuela has had serious economic and political crisis for almost 10 years now. One of the worst parts of this crisis is the breakdown of their healthcare system. So since around 2014, hospitals and pharmacies have had major medicine shortages. So even basic things like cancer medicine, insulin, are not able to be found in Venezuela anymore. This is mainly because Venezuela is part of the WTO, or the World Trade Organization. So this means that they have to follow specific global trade rules, including something called Tariffs. Tariffs is a rule that protects patents on medicines for up to 20 years. So if a company owns a drug, no one else is legally allowed to make a cheaper version of this drug for that amount of time. So this is a big problem in Venezuela because a country like Venezuela can't afford more expensive version of that medicine, and they can't easily make or import generics. So people are just not getting the treatment they need, and Tariffs just makes it harder to get affordable medicine when it's needed the most. So to deal with this, Venezuela passed a law called the Doha Declaration on Tariffs related in public health in 2001, and this reaffirmed the rights of people in countries in the WTO to protect public health and promote access to medicines for all, and also allowed more flexibility in compulsory licensing. So compulsory licensing basically just means that you can break the Tariffs agreement so that they can get cheaper versions. They also work with countries like Cuba and India to import the generic drugs after they broke this agreement. And they asked the WTO to treat their crisis as a public health emergency so the trade rules can be much more flexible. But even with this effort, Venezuela has still faced many challenges. Banks won't process payments because of the declining economy, and sanctions made it harder to buy medicine from other countries. But the UN and the World Health Organization stepped in with emergency aid, and this is where the slogan "Health Before Patents" came in and became more popular. Next, we'll be focusing on Kenya and their HIV crisis and their role in the WTO. So Kenya has one of the highest HIV and AIDS rates in the world. For years, treatment existed only for the rich. And this is because it costs about $15,000 to get treatment in Kenya per year, which most Kenyans cannot afford. So they are also part of the WTO. They're very similar to Venezuela this way. It has over, so they're also part of the WTO, and they use 3 specific rules to kind of fix the same conflict they had as Venezuela, which is generic drugs, compulsory licensing like Venezuela, and parallel importation. So in 2001, to help this, Kenya passed a new law called the Industrial Property Act, which made these 3 tools legal. By the way, parallel importation means buying the same drug from another country for cheaper. So Kenya also worked with other African nations and led a group at the WTO to fight for changes to Tariffs. And successfully this worked. The WTO eventually agreed to let poor countries import generics, even if they didn't have their own drug factories, which Kenya does not. So as a result, the HIV treatment in Kenya dropped from $6,000 to $500 per month. And also a Kenyan company called Cosmos Industries even got permission to produce the medicine for Kenya and nearby countries. However, there are still some challenges in this situation. For example, the country doesn't have a strong drug manufacturing system. There's a lot of corruption, and also in how health funding is used. And there's also fear of many lawsuits from big pharmaceutical companies that are trying to protect their own patents. And then why this matters to finance as a whole. So as we know, higher tariffs are going to lead to higher drug prices. And this hits hospitals, governments, and patients. It contributes to a lot of inflation in the healthcare system today. Next, tariffs and unstable trade rules scare off a lot of foreign investors. So this is especially bad for the low-income countries like Venezuela and Kenya that are trying to build a local pharmaceutical industry but are unable to do so. And then next, these disruptions create the risk for pharmaceutical companies, insurance firms, and even stock markets because drug companies rely on global efficiency. So, in conclusion, the tariffs on medicines don't just raise prices, but they also put lives at risk and shape the whole global financial system. Whether it's a family in Kenya, or a patient in Venezuela, or a hospital in New York, this issue is affecting people all around the world. So we need some trade policies that protect both health and economic stability. Thank you.
Does anyone have any questions?
Yeah, James.
How do you think this is related to American policy and tariffs? And do you think America, if they were to go to stuff like this, do you think they would be able to be self-sufficient?
Well, America in a way is not self-sufficient because, as I said at the beginning, APIs 70% are come from China and India, so most of their medicine is you do need other countries involved in it before getting any medicine in general. And also, this is affecting America as a whole too, not only other countries.
So if tariffs was still in place, realistically, what do you think would be the most effective solution for the U.S. and U.S. consumers?
Well, this presentation mostly focused on Kenya and Venezuela, but I would say that if the U.S. was going to make it have a solution, I mean, it relies a lot on, as I said, on the other countries. So maybe they would have to be more self-sufficient, make more drug factories in their own country, and not rely on these APIs from other places. Yeah.
Why are you interested in this topic?
Well, my dad is actually a pharmaceutical chemical engineer, so I grew up around this, and he told me a lot about it growing up. And later on in the summer, I'm working in a pharmaceutical company, focusing on these tariffs.